Every Monday, we're looking at new aspects of our health, and joining me today is Dr. Jacob DeLaRosa, a cardiothoracic surgeon from Port Neuf Medical Center.
Yes.
So, Dr. DeLaRosa, thank you so much for being here today.
Absolutely.
So, first of all, let's just talk about, there's kind of a new procedure that you guys up at PMC offer, and it's in regards to a heart procedure, kind of an alternative to open heart surgery, and it's called the TriClip procedure.
Yes.
Just tell us a little bit about that.
So patients who suffer from leaky valves in the tricuspid valve, we used to operate on them, do open heart surgery on them. We either go from the right chest or from the middle of the chest. Now we can do these minimally invasive, and we can do them through the groin and be able to repair the valve. We're also now moved to be able to replace the valve and be able to use what we call Evoke. It's a new valve that's been approved in the United States, and we're able to replace the valve actually in the tricuspid position without having to split the chest open.
Okay, and we're talking about, you said minimally invasive, don't have to split the chest open.
Yeah.
So I assume that that means a far shorter, far easier recovery time.
100%. So usually on patients who have leaky tricuspid valves or mitral valves, aortic valves, they, to have an open heart surgery, you're looking at 6 to 7 hours in the operating room, a week in the hospital, and then about 6 to 8 weeks to recover. Now we're able to do this in a couple hours and go home the next day and be ready to go. So it's a real big difference for people here in Southeast Idaho.
And is this something that everyone may be a candidate for, or is there certain, risk factors, different things that might prevent someone from being able to have this procedure?
So everyone's a candidate. As my old chairman used to say, everybody's pre-op. Everybody's ready to go. But what we do is we work patients up. What we do is do a CAT scan, echocardiograms, all the details to be able to see if they are a candidate for the procedure. And if they are, then we go ahead and do it. We offer it to them.
Okay. And what sort of quality of life improvements have you seen from patients that are doing this procedure versus the open heart surgery?
It's amazing. I think that patients that when they don't have to be in a hospital for a week, you don't have to recover from a big incision, and instead you can recover from a micro stab into the groin. It's incredible. They get going, they get better, and they're able to get function back to life again. And people who suffer from leaky valves like this tricuspid valve, they are really sick. I mean, they just can't move. They just can't have energy anymore. They want to take trips, see their grandkids, and they just can't do it anymore. And so we're able to give people life back again. It's pretty amazing.
Awesome. And I would assume there's probably a mental health factor in there as well. You don't have the big open scar on the chest. You don't have, like you said, a week in the hospital, plus a long recovery to be depressed about. It's a lot quicker with mental health as well.
For sure. Everybody just feels like they're ready to go. It's really incredible.
Okay, Dr. DeLaRosa, thank you so much for talking about that. We appreciate you being here.
We have to say hi to your mom real quick.
Yes, we got to say hi to Mom. So, Dr. DeLaRosa, thank you so much.
Absolutely.
Appreciate it.
Thank you.